The NCCN guidelines have become a very important part. They've really always been a very important part of our treatment paradigm. I think having guidance on what is out there and what we can use is important. And the reality also is it really helps us deliver that to our patients since payers pay attention to it.
Our group certainly does use the NCCN guidelines and guidelines by other organizations that have guided, appropriate care for prostate cancer patients, especially in the advanced setting. In this most recent update, we definitely recognize that the NCCN has acknowledged the use of ARV7 testing, again, as the most common splice variant and one of the most common mechanisms of resistance to advanced anti-androgen management. And so I think it's valuable to incorporate that into our testing, or at least consideration of patient management.
I most definitely refer to the NCCN guidelines, and I refer to them for the early side, for the low-risk localized patients, and certainly for the advanced patients. Now, keep in mind, guidelines are guidelines. They are meant to be broad and give you a framework for how to treat a patient, but every patient is different. Every patient is individual. And so something like ARV7, which is an individualized test to determine what treatment is good for that patient, is the point. So yes, you have to look at the guidelines and you have to sort of know what they're saying, but then it's also a doctor-patient shared decision-making that comes into play. So you have to use all of that at your disposal to make the right decision.
The NCCN guidelines is strictly adhered to within our practice. It is typically the gold standard that many of my medical oncology colleagues follow. And so with this new recommendation of ARV7 testing, I do feel that it is strongly recommended that oncologists incorporate this into their practice. I know many of my colleagues adhere to the NCCN guidelines, and it is strongly recommended that they do so.
So I think it's one of those things that is very helpful to us on multiple levels. And it's updated very frequently, so that's nice. And the recent updates that we've seen, including ARV7, are just a good example of that, because we have been using ARV7 whenever possible for patients in this time frame. But having it now in the NCCN guidelines certainly makes it easier for access for the patients to actually get the testing and to be able to see and understand why we're doing it. Not just the patient, but my partners and other people that we might be referring to are understanding the real role that this has in helping determine the next level of care.
We use the guidelines all the time. I think it's a great resource. Obviously in an academic setting, we use them as guidelines. We're on the NCCN committee, so we, of course, contribute at some level as well. Now with ARV7 testing, I think that's an important update and really should be considered in these patients, given the choices you have and given the fact that this is now a validated predictive biomarker. So that is, really a first in this area in prostate cancer. And so I think that it's going to be very useful in terms of providers going in there, looking at the guidelines, and then helping them make choices with their patients of which next therapy to use.